Hello friends, welcome to Instant Psych Initiative. In today's video, we are going to discuss about euthanasia. Okay, so euthanasia, which is also known as help to die. Actually, this is one of the legislation which is going to be passed in France. French president recently announced that they are going to pass a legislation which is related to euthanasia. So in this context, first we will try to understand the video components. In the components, first we will discuss about the context. Okay, in which context we are discussing this particular topic. Okay, after then we will discuss about active assistance dying legislation of France. Okay, what is this legislation is all about and what is this act is talking about. Then what is euthanasia? The status of euthanasia in India. You all know that euthanasia is two types, active as well as passive euthanasia. In India, passive euthanasia is allowed on very rare cases. Of course, here we would like to look at some of the Supreme Court judgments regarding the right to die. Then we will discuss about arguments in favor of euthanasia and arguments against euthanasia, legal provisions in India and related court judgments like I said earlier, and finally we will draw the conclusion. So these are the video components of this particular video. First, let us try to understand what is this euthanasia. Okay, so before that, the foremost thing is context. French President Emmanuel Macron recently announced that they are making of legislation that is help to die or end of life bill. So this will allow eligible patients, remember it is eligible patients, they can administrate a lethal substance on their own or with the help of third person under the precise conditions. Here keywords are under precise conditions, lethal substance and only eligible patient. So first, what is this euthanasia? So before you know about euthanasia, first you have to understand about right to life. Right to life. You know that right to life is one of the universal right guaranteed under United Nations Declaration of Human Rights. Not only that, even Indian Constitution also guaranteed right to life under Article 21. So this right to life can be taken away only on one condition, under one condition, that is procedure established by law. According to procedure established by law, through that only this right to life can be taken away by authorities. Right to established by law, procedure established by law. In this context, tell me students, the concept of procedure established by law we borrowed from which country, and the concept of due process of law, the concept of due process of law borrowed from which country? Okay, these two components are borrowed from which countries? Okay, comment your answer. So right to life. So when the right to life was there in the olden days, I mean in like few decades back, so right to life it was interpreted very narrowly. Nowadays, right to life interpret in such a manner that right to life inherently it is also including now right to die with dignity. Right to die with dignity. This is also inherently recognized as a part of right to life by various Supreme Court judgments and by various countries' legislations. As a part of right to die with dignity, when a particular person is suffering from any incurable disease, or when a person is in the vegetative status, okay, or when a person is in coma kind of situation, then the person is allowed to die. Okay, this allowed to die, this particular thing is known as euthanasia. Okay, euthanasia is killing of person, okay, under certain conditions, okay, precise conditions and only to eligible people. So euthanasia including two types of components, okay, passive euthanasia and active euthanasia. Passive euthanasia means it is okay. So if the patient is already on a treatment and if the patient is unable to survive, okay, if he is into vegetative condition or if he is in complete like coma kind of conditions, okay, in those conditions his treatment will be stopped. Okay, treatment, whatever the treatment you are giving to the patient, it will be stopped so that patient will die. That is a passive euthanasia. Whereas active euthanasia is about, okay, here lethal substance, a poisonous substance will be administered to that kind of patient, okay, when the patient is unable to survive or unable to come back to the normal life. That is known as active substance, active euthanasia. So in the active euthanasia, lethal substance will be administered. Lethal substance will be administered. Whereas the passive euthanasia, stoppage of life-saving treatment. Stoppage of life-saving treatment. Here you have to understand, in India, active euthanasia is not at all allowed. Only in India, passive euthanasia is allowed. That you have to understand here. Only passive euthanasia, that too in a very exceptional conditions it can be allowed. One of the popular case related to passive euthanasia, it was Aruna Shamba case. Aruna Shamba case. Now let's see first about the French legislation, then we will look into the India's conditions related to euthanasia. So in the French one, the objective of this bill is about alleviating the patients who are suffering from incurable diseases so that the patients will be allowed to die at their own will. Sometimes, students, one more interesting development recently is happening. When a person is in healthy condition, he can write a will. Okay, that will includes that if that person subjected to any incurable disease in future, okay, then this euthanasia can be executed. Okay, that is known as death will. Okay, nowadays this death will is also, it is getting into, more awareness among the people. European countries, so far, European countries which are legally allowing this euthanasia are Belgium, Netherlands, Luxembourg, Germany and Spain. These are legally allowing this euthanasia, nothing but assisted dying. Next, here this active assistance dying, it is about here this French legislation, it is about the active euthanasia, not the passive one. Here lethal substances can be prescribed to patient. Okay, this can be delivered to themselves or with the help of the third party. Here the third person can be any health volunteer, doctor or nurse who are treating that patient for certain period of time. And this whatever this this allowed, this permission, it is valid for 3 months. Within the 3 months he can retreat, the patient can retract this, this allow this, whatever the permission they given, that can be retracted, that can be withdrawn. Next, not applicable. This legislation is not applicable to minors who cannot take the conscious decision about themselves, as well as patients who are suffering from Alzheimer's disease and other psychiatric and neurodegenerative conditions, because they are unable to take, conscious decision with the right frame of mind. That is the reason this is not applicable to them. Then euthanasia, already I told you, it is about act of deliberately ending a person's life. It is having two types of euthanasia. One is the active euthanasia, the other one is the passive one. In the active one, lethal injection will be administered and it directly involves causing the death of the patient. It is illegal in India. Not only in India, in most of the countries it is illegal. Whereas passive euthanasia, here we allow intentionally, to die the patient with by removing the life supporting systems. It is allowed in India in certain conditions. Next, status of euthanasia in India. So passive euthanasia. In the case of Common Cause versus Union of India, court allowed passive euthanasia for terminally ill people, and active euthanasia, it is crime. Still it is crime in India, but now it is allowed in France. That you have to keep in mind. Next, arguments in favor of euthanasia. Obviously, what would be the argument? Best argument is we should allow a person to die with dignity. That is the first thing. And so here a lot of mental trauma can be reduced to that family as well. Pain can be ended and personal choice, dignified death, and addressing the mental agony to that person or their family members. So these are the argument in favor. Next, arguments against euthanasia. It is maybe against medical ethics. Sometimes it can be misused. Okay, when a wrong, ill-intentioned people are administrating this one, and it is morally wrong. And the fine difference between the suicide and euthanasia, that has to be recognized as well. And vulnerable people, they'll become more susceptible to this kind of things, especially if there is a unethical collusion between the hospital staff and the family members, okay, in those kind of situations. Next, judgments by Supreme Court. So in India, is like helping to someone, that is active euthanasia, is nothing but helping to someone to like in their death, that is nothing but section 306 of CRPC, and they will be punishable. But state of Maharashtra versus Maruti Shripati Dubal 1987, in this case Supreme Court observed that, Bombay High Court observed that right to life also includes right to die, and attempt to suicide, previously it used to be considered as crime, and this judgment said that this section is like constitutionally wrong, and this section was struck down in this particular case. So court clearly mentioned that right to die is not unnatural, and it also mentioned many instances in which a person would like to die. Okay, so this is how the concept of euthanasia slowly started building in India. And Gyan Kaur versus State of Punjab, in this court clearly mentioned that right to life guaranteed by Article 21, it does not include right to die, but it does not applicable to right to die, does not applicable to normal situations, but it can be selectively applicable to euthanasia cases. And Naresh Marotrao Sakre and versus Union of India 1994, in this case court clearly distinguished the difference between the suicide and euthanasia. Suicide is about the self-killing or self-destruction, an act of terminating one's own life, whereas euthanasia is about when a person is unable to survive, or when a person is unable to bear the pain. In this condition, when there is no choice, the euthanasia will be proceeded. So this is the fine difference between the suicide and euthanasia. Next, the way forward. So the way forward is about, so we have to ensure the access of quality palliative care, which focuses on comfort as well as symptomatic relief, and it should be a priority alongside any discussion of the euthanasia. First, we should mainly focus on giving the better health care and better critical health care, and then further we can discuss about this euthanasia. Next, yesterday's video question. An election commissioner shall not be removed from office except on the recommendation of whom? Except on the recommendation of Chief Election Commissioner. Here, the thing is, whatever the advice given by the Chief Election Commissioner to the President, it is binding. That means President has to act in according to that advice. Next, today's video question. If Parliament enacts a law that threatens fundamental rights of an individual, then which of the following articles can be used by the Supreme Court to declare it is void? Okay, which provision allows the Supreme Court to declare something as void if that law is violating the fundamental rights? Mains question. Examine the scope of fundamental rights in the light of K.S. Puttaswamy versus Union of India judgment. So this is about today's mains question. As we reach to the end of this video, in this video we mainly discuss about euthanasia and French government legislation on euthanasia. Apart from that, we also discussed about euthanasia in India, the difference between the active euthanasia, passive euthanasia, and various Supreme Court judgment related to euthanasia. So this is the detailed discussion regarding the euthanasia. I hope this video is helpful to you. Thanks for watching this video. Have a great day. Jai Hind.